Hi guys, Shelly, the IU Bachelor Degree Research Nurse, along with Jason Straw from Indiana Normal, who is also a critical care nurse. Jason and I both have experience in keeping patients safe from bacteria and viruses, and Jason even more so than me because he's actually worked in
IU bone marrow transplant, which we had to do reverse isolation to protect our patients who had no immune systems.
So Jason and I came on today because a lot of people are wanting to know about the peak in Indiana and what's going on. So we're both research junkies. We love to research. We spent hours and hours and hours of researching. So we started looking at some statistics and we find a lot of confusion, but we wanted to come on today and to talk because there was a huge jump today, right, in the numbers of the virus.
Yeah, on Channel 8, Governor Holcomb and Dr. Box talked about the numbers, and they gave us this report right here.
In which you can see that the virus itself, we had how many positives?
440 yesterday, and because it's always a day behind, and then 49 deaths, because they were saying it was trending down. They thought we had reached the peak.
And it was trending down. But Jason and I don't really understand how they could even begin to figure this up because we have been trying to look at statistics everywhere. And we even questioned, basically we want to know who the state health commissioner, Dr. Box, is. I asked Jason today, who is she? What is her credentials? So she seems like a lovely person. I'm sure she's great at her job. But it turns out that for 30 years, she has been an obstetrician and a gynecologist, which I'm not knocking there. It's a great profession to be in. It sounds like she does a lot of wonderful things to help women and their health. But in a situation like this, if I were in a unit that had infections, I wouldn't be working beside her. This is not normally the type of a doctor or physician that we would see in position during a pandemic, epidemic of a virus. So there's questions about where some of our information is coming from, how it's being handled overall. We aren't prepared, obviously, for this. We don't even have protective stuff for our healthcare workers. So Jason brought up statistics. We were looking at the Indiana Health Department, and as you can see, they have not even updated their chart in 5 weeks.
For the new cases. So the first one that they updated was April 12th, and they reported 1 case. So the first 5 weeks in that graph, they didn't put any data whatsoever. This is where we get some confusion. I had this confusion when I was doing the opioid crisis for the last 5 years, working on it, doing reports. I even did a PowerPoint presentation on the misinformation or incorrect information. And I found that they reported 5 different numbers for the same year to different groups, like the CDC, Medicare, Indiana State Health Department of Health, and the media. And the lowest number that they gave out was to the media.
So our concerns are, basically overall, we literally spent a day and a half trying to come up with numbers to show you guys, and it's just been everywhere. So what we overall finally thought was the easiest and most logical way was to take the overall number of tests that have been done in the state of Indiana, which is since the beginning of time, since the beginning they started testing people, correct, Jason?
Yeah, since March 6th.
So since March 6th, how many tests have we done in the entire state of Indiana? And the number is
48,396 is what Dr. Box said today.
Which sounds like a very large number, man. That's like almost 50,000 people have been tested in the state of Indiana.
I know.
But the reality of that is...
So that comes out to 1,241 tests a day on average, and we have 92 counties. So that's 13.5 tests per county per day on average.
And then some people might argue, well, we didn't have the tests and we didn't have the capability. But Roche actually donated tests free of charge.
Well, those are the rapid tests.
And the rapid tests were donated in time that we should have had some to do some of these tests, correct?
Correct, but we had the standard tests that Dr. Box said that we were struggling to keep up, and they had the capability since April, all the way up till April 8th, really, to do 3,700.
Because 3 new facilities opened.
No, this is before.
Before.
3,700, okay. We had the ability to do 3,700 tests per day throughout the state of Indiana, and when the private companies came on board, they were going to come around 6,000 per day.
So we have capability to test 6,000 per day.
So
the number that you just gave us, there were how many counties in the state of Indiana, Jason?
Well, let's go back to the average per day, which was 1,241, which is about a third of the capability before we opened up those private industries to do the testing.
Okay, so how many counties are in the state of Indiana, Jason?
92.
So there's 92 counties, and you said how many tests were done per day?
1,241 throughout the entire state, or 13.5 per county.
So 13 point, if you actually broke that down, and not that they're going to do that because they probably tested where it's people are the most sickest, but if you actually broke that down, and we're just doing it statistically so you can see the numbers, that is how many people could we have tested in each county, Jason?
Well, if you break it down, you just divide by 100 instead of 92. It's a little, we could do about 60 plus a day with the new capabilities in Indiana instead of 13.5.
Okay, so we actually are doing 13.5.
And we could do
at least
over 60.
per county. Per county. Okay, so those are just some things to think about. So when you guys are asking about peak, it's like there's monkeys in charge and we have no clue. I don't believe that we're at peak on this. I believe this is going to be extended a little bit longer than they're leading you to believe. I don't think government and public officials should be making healthcare decisions.
And I believe that you need to have specific healthcare officials, epidemiologists, infection control doctors and nurses, people who deal with these things on a regular basis, not people who have a general knowledge. We have generalists for a reason, and so hopefully we can get a little better data. State starts rolling some of these things out, and we'll give you information as we can figure it out.
Yes. And if there are healthcare professionals out there and you are testing at your facilities, could you please tell us what you've seen them doing as far as testing? Because I have legit had people telling me that they're taking patients in from nursing homes and they're not testing them, or patients are going in saying I have every single symptom and I'm not getting tested. So I don't understand if we have the capability, we have the tests now where we're not doing them. But if you see it differently, please tell us, because we're looking at numbers and it just doesn't make sense to us. So just some thoughts to ponder. We love you guys. Keep each other safe. Sorry it's a long video. Love y'all.